Drug used for motion sickness is scopolamine, promethazine, diphenhydramine. All of the above. Shortic answer, all of the above. Drug used in organophosphorus poisoning is atropine, pralidoxin, both A and B. Which hormone stimulated ovulation in female? Progesterone. Deficiency of insulin result in diabetes mellitus. The pacemaker of heart is SA node. Normal value of blood pH is 7.4. The blood volume of the average adult is about 5 liter. The blood volume of an average adult is about 5 liter. Which vitamin is essential for blood clotting? Vitamin K. Which vitamin is essential for blood clotting? Vitamin K. The universal donor blood group is A and B. The universal donor of blood group. The universal donor blood group is O. The universal donor blood group is O. The universal reception blood group is AB. Enzyme pepsin digestion protein. Enzyme pepsin digestion of protein. The functional unit of kidney is nephron. The functional unit of kidney is nephron. The normal lifespan of WRBC is 120 days. The normal lifespan of RBC is 120 days. Which vitamin is essential for vision? Vitamin A. Which vitamin is essential for vision? Vitamin A. Which organ is called master gland? Pituitary gland. Which organ is called master gland? Pituitary gland. Which vitamin prevents scurvy? Vitamin C. Which vitamin prevents scurvy? Vitamin C. Goiter is caused by deficiency of iodine. Goiter is caused by deficiency of iodine. Which blood group is universal reception? Vitamin A. Blood group AB. Which blood group is universal reception? AB. Urinary antiseptic drug is nitrofurantoin. Urinary antiseptic drug is nitrofurantoin. Amyl nitrate is used as antidote of cyanide poisoning. Amyl nitrate is used as antidote in cyanide poisoning. Which insulin has longest duration of action? Insulin Glargine. Which insulin has the longest duration of action? Insulin Glargine. Antidote for warfarin overdose is vitamin K. Antidote for warfarin overdose is vitamin K. Which drug causes orange-red discoloration of urine? Rifampicin. Which drug causes orange-red discoloration of urine? Rifampicin. Drug of choice for thyroid fever is cefitriaxone. Drug of choice for thyroid fever is cefitriaxone. Which drug causes tooth discoloration in children? Tetracycline. Which drug causes tooth discoloration in children? Tetracycline. First line drug for leprosy is all of the above. Rifampicin, dapsone, clofazimine. First line drug for leprosy is rifampicin, dapsone, clofazimine. Fast pass metabolism is maximum in oral route. Fast pass metabolism in maximum in oral route. Zero order kinetic show by phenytoin, ethanol, aspirin. Zero order kinetic is shown by phenytoin, ethanol, aspirin. Which phase of clinical trial is for safety? Phase 1. Tachycardia means rapid decrease in response. Tachyphylaxis means rapid decrease in response. Parkinson disease is treated with levodopa plus carbidopa. Parkinson disease is treated with levodopa plus carbidopa. Beta blocker used in glaucoma is atenolol. Beta blocker used in glaucoma is atenolol. Calcium channel blocker is amlodipine. Calcium channel blocker is amlodipine. Long acting insulin is Gardgen. Long acting insulin is Gardgen. Which blood cell are responsible for clotting? Platelet. Which blood cell are responsible for clotting? Platelet. Chelating agent for copper is penicillamine. Chelating agent for copper poisoning is penicillamine. Chelating agent for iron poisoning is deferoxamine. Chelating agent for iron poisoning is deferoxamine. The enzyme that digests starch is amylose. The enzyme that digests starch is amylase. Which organ produces bile? Liver. Which organ produces bile? Liver. Pancreas produces insulin enzyme. Liver produces bile. The pH of gastric juice is 1:2. The pH of gastric juice is 1:2. The Bros border enzyme are present in small intestine. Mouth salivary enzyme. Mouth salivary enzyme. Stoma release pepsin HCl. Stoma release pepsin HCl. Large intestine absorb water. Large intestine absorb water. The Bros border enzyme are present in small intestine. The Bros border enzyme present in small intestine. The main site of nutrition absorption is small intestine. The main site of nutrition absorption is small intestine. Stomach digestion. Small intestine site of absorption. Large intestine absorb water. Vitamin B12 absorbed in ileum. Vitamin B12 is absorbed in ileum. Duodenum absorb iron. Jejunum absorb carbohydrate. Which enzyme digests protein in the stomach? Pepsin. Which enzyme digests protein in the stomach? Pepsin. Pancreas secrete amylase, lipase, trypsin. Pancreas secrete the movement of the food to digest tract is called peristalsis. The main function of large intestine is water absorption. The main function of large intestine is water absorption. The functional unit of kidney is nephron. The functional unit of kidney is nephron. Glomerulus is the only filtration unit. Glomerulus, only filtration unit. Which hormone regulates the water balance by kidney? ADH. Aldosterone regulates sodium. PTH calcium balance. Insulin blood glucose. Insulin blood glucose. Which hormone regulates water balance by kidney? ADH. Vasopressin. Which hormone regulates water balance by kidney? ADH. Aldosterone regulated sodium. Aldosterone regulated sodium. PTH calcium balance. PTH calcium balance. Normal pH of urine is 6. Normal pH of urine is 6. This substance is not normally present in urine. Glucose. Which blood vessel bring blood into kidney for filtration? Renal artery. Which blood vessel bring blood into kidney for filtration, renal artery. Which part of nephron is responsible for filtration? Glomerulus. Which part of the nephron is responsible for filtration? Glomerulus. The nitrogenous waste is most evident in urine area. The nitrogenous waste is most evident in urine area. Aldosterone increase sodium reabsorption. Sodium reabsorption. Potassium reabsorption promote potassium excretion. Dialysis is used in kidney failure. Dialysis is used in kidney failure. The hormone renin is secreted by juxtaglomerular cell. The hormone renin is secreted by juxtaglomerular cell. Adrenal gland secrete aldosterone. Adrenal gland secrete aldosterone. Pituitary gland secrete ADH, GH. Pancreas secrete insulin, glucagon. The female gamete is ovum. The female gamete is ovum. Sperm is a male gamete. Sperm is a male gamete. Zygote is a fertilized egg. Zygote is a fertilized egg. Site of filtration in female is fallopian tube. Site of filtration in female is fallopian tube. Ovary produce egg. Ovary produce egg. Uterus. Implantation. Fallopian tube fertilization site. Fallopian tube is a fertilization site. The hormone responsible for ovulation is LH, luteinizing hormone. The hormone responsible for ovulation is luteinizing hormone. The male hormone is a testosterone. The male hormone is a testosterone. Which structure is stores sperm? Epidermis. Which structure stores sperm? Epididymis. Vas deferens transport sperm. Vas deferens transport sperm. Inflammation of zygote occur in uterus. Inflammation of zygote occur in uterus. Bad-Vein syndrome is caused by vancomycin. Gray baby syndrome is caused by chloramphenicol. Bioavailability of drug IV is 100%. Idosynocracy is a genetic abnormal drug of response. Idosynocracy is a genetic abnormal drug response. Loop diuretic is a furosemide. Loop diuretic is a furosemide. Drug causing Reye syndrome in children, that is aspirin. Antidote for paracetamol poisoning is option A, N-acetylcysteine. Antidote for paracetamol poisoning is N-acetylcysteine. Proton pump inhibitor is omeprazole. Urinary antiseptic drug is nitrofurantoin. Direct acting of vasodilator is minoxidil. Antidote of atropine poisoning is physostigmine. Antidote of atropine poisoning is physostigmine. ACMRM selective estrogen receptor modulator is tamoxifen. Letrozole is a aromatase inhibitor. Anastrozole is a aromatase inhibitor. Atropine blocker which neurotransmitter? Acetylcysteine. Atropine block which neurotransmitter? Acetylcholine. Clofebrate is used in treatment of hyperlipidemia. Clofebrate is used in treatment of hyperlipidemia. Amyl nitrate antidote used in cyanide poisoning. Amyl nitrate antidote used in cyanide poisoning. Pentazocine acton mixed agonist antagonist. Antidote for digoxin toxicity is digoxin Fab antibody. Malaria is a primaquine. Flumazenil is antidote for benzodiazepine. Longest acting insulin is glargine. Longest acting insulin is glargine. Tetrazonic effect of thalidomide is pocomelia. Diuretic causing hyperkalemia is spironolactone. Diuretic causing hyperkalemia is spironolactone. Haloperidol is a topical antipsychotic. Antidote for heparin overdose is protamine sulfate. Atropine for heparin overdose is protamine sulfate. Antidote for warfarin overdose is vitamin K. Antidote for warfarin overdose is vitamin K. Metformin class of biguanide. Metformin is a class of biguanide. Sulfonylurea is a glibenclamide. Meglitide is a ripraglidine. Mechanism of sulfonamide is a inhibit folate synthesis. Mechanism of sulfonamide is a inhibit folate synthesis. Antitubercular drug causing optic neuritic is ethambutol. Antitubercular drug causing optic neuritic is ethambutol. Which drug cause orange-red discoloration of urine? Rifampicin. Which drug cause orange-red discoloration of urine? Is rifampicin. Stevens-Johnson syndrome adverse effect of sulfonamide. Stevens-Johnson syndrome adverse effect of sulfonamide. Amphotericin B is used as fungal infection. Drug of choice of MRSA is vancomycin. Mechanism of macrolides is 50S ribosome inhibitor. Mechanism of macrolides is 50S ribosome inhibitor, which is a fluoroquinolone. Ciprofloxacin. Mechanism of tetracycline is a 30S ribosome inhibitor. Mechanism of tetracycline is 30S ribosome inhibitor. Drug of choice for typhoid fever is ceftriaxone. Drug of choice for typhoid fever is ceftriaxone. Which drug cause tooth discoloration in children? Tetracycline. Which drug cause tooth discoloration in children? Tetracycline. First line drug of leprosy is all of the above, like rifampicin, dapsone, clofazimine. All of the drug used for leprosy. First line drug. Which drug cause hemolysis in G6PD deficiency? All of the above, like nitrofurantoin, sulfonamide, primaquine. Mechanism of aminoglycoside is inhibited 30S ribosome. Antitubercular drug hepatotoxicity is all of the above. Rifampicin, pyrazinamide, isoniazid. Which drug inhibited ergosterol synthesis? Ketoconazole. Which antimalarial drug causes chinchonazine quinine? Fast pass metabolism in maximum in Euler route. Fast pass metabolism in maximum in Euler route. Zero kinetic is shown by all of the above. Phenytoin, ethanol, aspirin, all of the above. Drug with narrow therapeutic index is digoxin, theophylline, lithium. Which phase clinical trial for safety? Phase 1. Which route bypass liver metabolism? IV. Example of pharmacovigilance is ADR monitoring. Tachyphylaxis means rapid decrease in response. Drug producing disulfiram like reaction with alcohol. All of the above. Metronidazole, cephalosporin, chloropromamide. Benzodiazepine act on GABA A receptor. Antidote for benzodiazepine overdose is flumazenil. Parkinson disease is treated with levodopa plus carbidopa. Drug causing gingival hyperplasia is phenytoin. Absent seizure drug of choice is ethosuximide. Lithium toxicity include tremor, hypothyroidism, nephrogenic diabetic insipidus. Neuroleptic malignant syndrome caused by haloperidol. A typical antipsychotic list likely to cause EPS is clozapine. Drug of choice in status epileptic is loperazepam. Drug of choice for alcohol de-addiction is all of the above like disulfiram, naltrexone, esimoprostol. Autonomic nervous system is a prozasin. Beta 1 selective blocker is atenolol. Non-selective beta 1 blocker is propranolol. Beta 1 blocker using glaucoma, timolol. Muscarine agonist drug is pilocarpine. Anticholinergic drug used in asthma is ipratropium. Non-depolarizing neuromuscular blocker is pancuronium. Depolarizing neuromuscular blocker is succinylmethonium. Alpha-2 agonist used in hypertension is clonidine. Sympathomimetic causing bronchodilation is salbutamol. ACE inhibitor example is rifampicin. Angiotensin receptor blocker is losartan. Calcium channel blocker is amlodipine. Thiazide diuretic is hydrochlorothiazide. Potassium sparing diuretic is trimethylene amiloride spironolactone. Osmotic diuretic is mannitol. Nitrate used in angina, nitroglycerin. Antiarrhythmic drug causing thyroid toxicity, amiodarone. Antiplatelet drug is aspirin, clopidogrel, ticlopidine. Endocrine and miscellaneous is long-acting insulin is Gargin. Sulfonylurea is example of glibenclamide. Sulfonylurea is example of glibenclamide. Drug causing lactic acidosis, metformin. Thiazolidinone example of piglotijan. Alpha glucoside inhibitor is ascarbose. Corticosteroid side effect is osteoporosis, hypoglycemia, Cushing syndrome. Selective COX-2 inhibitor is celecoxib. Anti-gout drug inhibitors xanthine oxidosis, elopinol. Uricosuriae is a drug of probenecide. Chelating agent for lead poisoning is EDTA. Chelating agent for iron poisoning is deferoxamine. Chelating agent for copper poisoning is penicillamine. Drug used in organophosphorus poisoning is atropine pyridoxamine. Antidote for opioid overdose is naloxone. Antidote for methanol poisoning is fomipizole and ethanolol. Drug used in motion sickness is all of the above: scopolamine, promethazine, dihydrogenate. Most common phase 2 reaction is option B, glucuronide conjugation. Most common phase 2 metabolism. Most common phase 2 reaction is option B, glucuronide conjugation. Thrombophlebitis is caused by IV. Drug that inhibited plasminogen activator. Antifibrinolytic drug. Antiplatelet drug, also known as antithrombotic drug. Universal local anesthetic is lidocaine. Universal local anesthetic is lidocaine. Reversible cholinesterase inhibitor is physostigmine. Drug useful in Parkinson disease. Benzotropine. Drug useful in Parkinson disease. Benzotropine. Powder used in body cavity is surgical dusting powder. Powder used in body cavity or umbilical cord is surgical dusting powder. Potent substance mixed with diluent. Geometric diluent. Drug bioavailability fasted in solution. Drug bioavailability fasted in solution. Anti-angina causing tachycardia is nifedipine. Anti-angina causing tachycardia is nifedipine. Stimulant purgative contraindicated in specific constipation. GORD drug reducing uric acid synthesis in allopurinol. Streptomycin, chloramphenicol, tetracycline are antibiotic drug. (20 to 80 healthy volunteers). Phase 1 clinical trial is 20 to 80 healthy volunteers. Neurotransmitter amino acid derivative glutamic acid. Chlorpromazine property is antidopaminergic. Angiotensin II affected result in water retention. Tuberculosis is a bacterial mycobacterial tuberculosis. Causative agent of tuberculosis is Mycobacterium tuberculosis. Sodium fluoride in dental carie promote remineralization, slow demineralization, alter plaque bacteria. All of the above. Total monograph in latest edition is 3152. Volume 3 of BP content blood and immunological product. Volume 3 of BP content blood and immunological product. Not a function of inspector. Maintenance of register. Kala Jadoo, Kabacha fall under Schedule J. TEGA regulated agency of Australia. Case Korsakoff syndrome is caused due to deficiency of vitamin B1. Option A. Wernicke-Korsakoff syndrome is caused due to deficiency of vitamin B1. Chelosis occur due to deficiency of option B. Riboflavin. Chelosis occur due to deficiency of vitamin B2, riboflavin. The fluid or liquid part of the blood is called plasma. The fluid or liquid part of the blood is called plasma. Cardiac output is the product of heart rate and stroke volume. Cardiac output is the product of the heart rate and stroke volume. Option C. Which of the following is a bone articulated to the form of leading joint? Correct answer is option B, carpal. Suture between the bone of the skull are example of fibrous joint. Synovial joint is a movable. Fibrous joint is a suture are immovable fibrous joint. Cartilaginous joint is slightly movable. Movable joint are opposite of suture. Freely movable joint of the body also called as synovial joint. Freely movable joint in the body are also called as synovial joint. The point at which a business reorder new stock from supply is called recorder level. Which of the following method used for the sale promotion? Coupon, trade stamp, free sample, all of the above. The second step in the selling process is prospecting. The layer responsible for absorption of secretion in GIT is mucosa. Breakdown of carbohydrates start with secretion of salivary amylase. Alpha cell of pancreas secreted insulin. Insulin secreted beta cell, but alpha cell secreted glucagon. Buprenorphine acts as a partial agonist at mu receptor. The hormone is known as anti-aging hormone is melatonin. Which anti-tubular drugs should not be given to patients having both TB and AIDS? Thiocetazone. Sebaceous gland are classified as halocrine gland. Parathyroid hormone increase blood calcium level, calcium reabsorption, bone reabsorption. Enzyme absent in gastric juice is pethylene. Enzyme absent in gastric juice is pethylene. Enzyme not present in pancreatic juice is enterokinase. Which of the following is not a component of the urinary system? Adrenal gland is not a component of urinary system. The most common respiratory subtract as glucose. Residual air is mostly present in alveoli. Intercalated discs are present in cardiac muscle. The condensation system of the heart located in myocardium regulated heart rate rhythm.